Hello, everyone, and welcome to today's interview. My name is Jakob, and I work as an equity analyst at Kalqyl. Today, I'm here with Kim Baden-Kristensen, who is the CEO of Brain+. Welcome to the show, Kim.
Thank you, Jakob.
All right, so could you please start telling our viewers who may not be familiar with your company a bit about Brain+ and its business operations?
Absolutely. So at Brain+, we are working to bring dementia therapies to people with dementia. And we're working with so-called digital therapeutics, which means that it is software that drives and helps deliver this therapy to people. And we have a couple of products for that we have developed with the leading KOLs in the market based on something called cognitive stimulation therapy, which is the leading non-pharmacological therapy in the world today with by far the strongest clinical evidence in terms of helping people alleviate the primary symptom of dementia, which is cognitive decline. So this is when people lose their ability to pay attention, to remember things, to do everyday tasks. So we're really helping address the most critical aspect of dementia with this therapy.
And I think most of our viewers know that dementia is an area of very unmet needs. Could you please go into more detail about the exact value offerings of your product and how your company's technologies are unique compared to competition?
Absolutely. So the thing is that today, when people get a dementia diagnosis, a few of them are offered to get on medicine, even though that doesn't help them very much on the cognitive side and has a lot of side effects. And many of them don't get offered anything, and they certainly don't get anything beyond medicine. So people feel quite helpless. So what we are offering is basically to give them access to a therapy that can improve cognition in a way that corresponds to a 6-month delay in cognitive decline. This is kind of the clinical efficacies that has been shown on this therapy. So we have a couple of products already on this. The first product is a product that helps therapists who are doing this therapy to deliver it in an efficient way. The way this therapy is being done today is that people gather in a group, 4 to 8 people with mild to moderate dementia, and the therapist will then guide them through 45 minutes to an hour of activities that are really stimulating to the brain. This is based on very specific principles, so it's not just any activities, and this has again and again shown to give this clinical effect. So what we're doing is that we are delivering all the clinical content that is needed for the therapy. We're doing that in a very structured way. And basically, we're saving all the therapists a lot of time in preparation, which is one of their key pain points right now. The second is that we're ensuring that the content quality is of highest caliber. This was developed with the leading scientists and clinicians in this therapeutic field over many years. So it's not a small thing to develop this content. And that ensures that the quality of the therapy being delivered is actually okay. That's the first product. This is one that we already have live in the market in Denmark. The second product, which is in the development, is one that allows people to do this therapy at home with somebody from their own family. So imagine that you had a parent with dementia. You could basically sit and do this therapy with them. The software would guide the whole process, provide all the content for that, and that enables you to actually have this therapy at home. So that is something that really opens up to a lot of people who are not getting any type of therapy today. So that's the two primary products that we have in the next couple of years. The first one already on the market, the second one coming on the market probably late next year or early 24 or early 25. And then we have a third product in the pipeline, but that's a little bit more longer term. This is for the so-called mild cognitive impairment stage. And this is just before people get their dementia diagnosis, they still have significant decline in their ability to function. And this is a diagnosis as well. And it's much larger than dementia, actually. About where there's 55 million people with dementia today, there might be 150 to 200 million with mild cognitive impairment. And so this therapy can also go in and help these people, but they need something that is more challenging than people with dementia who is already progressed in the disease.
And I also think it would be interesting to hear a little bit more about the technology platform behind your tools. Can you please explain a little bit about that?
Yeah, so absolutely. There's kind of, first of all, on the practical side, which is important, this is something that needs to be available on all types of devices, right? So it's on mobile devices, like it can be tablets, it is on web, and it is something that can be thrown up on a big screen, because often when these therapies or these sessions are being done, the content is up on a big screen. That's kind of on a basic level. Otherwise, we're basically using just the state-of-the-art software development, the systems like Flutter for developing the front end and all of these things. We are having we're developing special customization features, which is allowing a therapist to basically customize the content based on the patients that are in their groups, because people have a very wide variety of cognitive function, even if they have the dementia diagnosis. The span from mild to moderate dementia can be quite large in terms of what they're actually capable of doing. So the features on the platform is being developed to basically go in and customize the therapy to the special abilities of the people that are there. So that's a bit on the platform. It's cross-platform. It works on iOS, on Android, etc. And it is something that also enables therapists to monitor therapy being done at home. So it collects all the data on activity data and other data that the therapist can then monitor to check whether the patient is actually adhering to the treatment, which is one of the important things in medicine. Anybody who works with regular medicine knows that adherence is one of the challenges. And this is where digital therapies actually have an advantage, because we get data on whether people are using it and can basically intervene in real time. If the therapy being done at home is not being done, then a therapist can actually follow up on that. And the system can follow up on that. The system can, of course, remind people.
Very interesting. So are your products based on clinical evidence? Has there been any research made? What does that look like?
Yeah, that is kind of the foundational idea and requirement in digital therapeutics, is that it's evidence-based. So as I mentioned, our products have been developed on top of the largest clinical evidence base in terms of dementia therapy, which is for cognitive stimulation therapy. And we have been working the last 5 years with the leading clinicians and physicians in this field to develop our product version of that. There has been both a number of trials on the technologies that we have in portfolio, that is both feasibility and early proof of concept trial with positive results. We've had some news out about that over the last few years. And we are also continuously running trials. So we'll be running a small usability trial here in Denmark in the fall. We'll be running a larger one in the spring. And then we also have pilots that we will be doing in the United Kingdom next year.
All right. And what about your main target groups? At what points in the disease progression does Brain Plus come in, and how does your treatment compare to other alternatives out there?
So upon people being diagnosed, if they are in the mild to moderate segment, so they haven't progressed all the way to the severe, that's basically when our therapy and products come into the picture. So immediately after diagnosis, you can say, is the right time for the first two products. For the third product, then that would be also immediately after diagnosis. That's then in the earlier stage, in the MCI stage.
I think it would be interesting to hear what do you believe are the main value drivers for like digital therapy for dementia. What do you see? And also how Brain Plus approach to ensure a high quality on their products and also a good market fit?
Yeah. So like, let's start with the value drivers. One thing is, of course, the total addressable market, which is the number of people with dementia. And unfortunately, that is growing very fast. So from a business perspective, that's good, of course. From a human perspective, not so good. But the number of people with dementia, that's going to triple and reach 150 million in the next couple of decades. So that is really driving. That's because we're aging. It's an aging population, right? And it's only the pyramid, the age pyramid is going that way, right? So that's a value driver. A second value driver is that digital therapies are increasingly being reimbursed by health insurance and healthcare payers around the world. It's going really fast in the UK, in Germany, and the United States, which are the large target markets that we're focusing on. So that is a key value driver, because that means that the patients don't have to pay themselves, obviously. The state or the insurance is paying for it. So that's a key value driver. The general adoption and awareness of digital therapies is also dramatically improving, both in terms of people of all ages actually using and being willing to use digital therapies, but more importantly is actually that the clinicians and the physicians are accepting the clinical relevance of these types of therapies and start using them. So these are some of the key value drivers. Brain Plus is very well positioned because of the work that we've been doing for a number of years now. And one of the ways that we're ensuring quality and also ensuring product market fit, by the way, both of those go very much hand in hand, is by having co-developed this with the leading clinicians and with the patients all the way. And so we're always co-developing, and we're always continuously usability testing in both smaller and larger pilots in the market to make sure that we have the product market fit. This is kind of a classic medical device development approach that we're taking here. And of course, now that we're live in the market, we're also getting continuous feedback and doing continuous improvement.
Yeah, nice. So in terms of commercialization, where is Brain Plus there? How far have you come?
So we're in the early stages of commercialization. We launched the product in Denmark about a month ago, and this here we're targeting business to government, selling software as a service license agreements to Danish municipalities, which are the ones taking care of people with dementia. We've closed the first couple of sales. We've expanded the first one to be a larger contract, and we are expecting to close more sales here in Q4 of this year. And all of this feeds into the sales cycle of municipalities, which is anywhere from 12 to 18 months from you begin negotiations to actually close negotiations with municipalities. But that's just the home market. The really big potential is in the larger markets like the United Kingdom, where there are 6,000 trained therapists in this therapy. So it's the largest market currently for cognitive stimulation therapy. And there we are expecting to launch next year. Again, there we're working with the ones who invented this therapy, which is the University College of London, and have very strong connections into the UK ecosystem. We're also working with lead clinicians and experts in Germany. There we're taking a more of an approach where we are integrating our product with the education of newly trained therapists. So that is the key focus in Germany, is doing that, which means that any therapist that gets trained in this will actually be introduced to our product. And that's a way to drive demand right at the source of any new therapists coming out. We're, by the way, taking a similar approach also in Denmark and in the UK.
And about the revenue model, it would be interesting to hear a little bit about how you make money.
Yeah, so the initial revenue model in a country like Denmark, as I said, is B2B software as a service contracts. So that's a model that everybody knows. But where the big potential is, and what we're aiming for in the large markets, is to have this reimbursed at national level. So in England, for example, you can have something like the National Institutes of Healthcare Excellence recommend a therapy, which means that if they recommend it, it should be offered in the entire national health system of England. And so that is really what we're going for in a market like England, or in Germany, where you have national reimbursement channels. Most people have heard about the DiGA, and fewer people have heard about the DiPA, which is another one which is very relevant for us. So there we're going for this, which means that all of a sudden you don't have to worry about which budget will this be paid from, because it's already approved on a national level.
All right. And what do you consider are the most important milestones for Brain+ to achieve, both in the near term but also in the long term?
So I think to keep showing that the customers actually want this, that the demand is out there. So basically to continue selling as we're doing now in Denmark, then launching into a larger market, I think for me is a very important milestone, and then continuously getting more evidence. So building on the evidence base we have already, but continuously getting more clinical evidence and then showing product market fit. So there's a commercial track, and then there's an evidence track, and both of these milestones in both tracks are important for building value.
And is there anything that is particularly hard working with for Brain+, something that is challenging that you would like to mention?
Yeah, this is an innovative new way of delivering therapy, of course. So that always comes with regular challenges of finding product market fit, of getting healthcare payers to actually pay for it, and getting physicians to actually use it, and in time to get them to also even prescribe it, right? So I think these are some of the classic barriers that we are also facing, trying to get a new innovative therapy into the market.
Yeah.
We are helped by the fact that this therapy has so much adoption in the analog form already, that our digital delivery of it basically can build on top of that.
All right. And finally, you have an ongoing TO2 warrant exercise, and it ends next week, by the end of next week. It would be interesting to hear about how you will use the proceeds, and also what your future funding plan looks like.
Yeah. So we will use the proceeds to continue with the commercialization that's already happening in Denmark, to prepare for particularly the UK market, which again is where we see the biggest potential in the near term. Then we will use the market for the ongoing development of the product. So we have the second version of the first product coming out in the first half of next year, and that's a big jump in the benefit and the value to the patients. The customizability of the treatment will be much larger in that version of the product. So that adds a lot of value and can increase the price that we're charging, and will also basically open doors to more customers. So I think these are the two main aspects that we'll be using the money for. In terms of our ongoing funding plans, then we also have a TO3 warrant, which will be exercisable in March. And that is, of course, for existing shareholders who have already bought Brain+ stock. We had a unit rights issue earlier this year. But if you're a new shareholder who's interested in coming in, these warrants can actually be bought in the market. So there are two options. One is just to go and buy Brain+ shares, and the other is to go and buy Brain+ warrants in the market. So they're tradable if you search under Brain+ TO2 and Brain+ TO3.
All right. And that was all from me. And with that, I would like to thank everyone who's been watching, and also big thanks to you, Kim, for taking the time. And I would also like to mention that we will be releasing a Twitter thread about the company later this week. So if you're interested, please check that out. Thank you for watching. Bye-bye.
Bye-bye.